show a case of left chronic otic retraction and perforation following Serous Otitis. It's a case of 60-year-old male patient have history of 10 years of left moderate progressive hearing loss. My patient had transverse maneuver is performed while his left ear is examined with the otoscopy, and this technique is performed with the following steps. Inhale deeply, close his mouth, pinching his nose shut, then hold the breath about 10 seconds. Breathe out forcefully to release the breath into left ear. And you can see the pulse expelled from the middle ear. Then he had the audiogram and tympanogram to show conductive hearing loss in grade 3. And the CT scan of left temporal bone show evidence of colorectal tumor. And this guiding surgery of the modified radical mastoidectomy with special attention to the ossicular chain can be considered. Thank you.